Hi, my name is Alexa Caramaza, and I'm a Sports Med 3 student and a sports psychology student at South Tahoe High School. For my fourth Sports Med project, I analyzed and researched a medical journal based on depression in athletes. With this information, I hope to educate athletes about depression, break the stigma around depression, discuss the investigated rates of depression in athletes, and discuss relevant risk factors that can contribute to depression. I analyzed a research journal entitled Depression in Athletes, Prevalence and Risk Factors, written by Dr. Andrew Wallinen, Dr. Eugene Hong, and Dr. Michael Gross. This journal was written and studied to review the current research on athletes and depression and to highlight that this is an issue in much need of further study because mental health is just as important as physical health. Signs and symptoms. Most people think that the only sign of depression is sadness. However, when someone is genuinely suffering from depression, they actually show signs of anxiety, apathy, general discontent, guilt, hopelessness, loss of interest or pleasure in activities, mood swings, or sadness in their mood. You can also see these changes in behavior through agitation, excessive crying, irritability, restlessness, or social isolation. When suffering from depression, some can also struggle with waking up early, excessive sleepiness, restless sleep, and insomnia. Defining the issue. According to Wallinen, Hong, and Gross, there are approximately 400,000 NCAA student athletes competing each year, and 5 to 7 million high school athletes involved in competitive interscholastic sports. Given such high prevalence rate in certain age groups and a large denominator pool of athletes in these age groups, it is reasonable to surmise that there are thousands of athletes with depression participating at the high school and college levels. Recently, sports medicine and sports psychology practitioners and researchers have turned their attention to this important issue, as past notions that athletes have reduced mental health issues due to increased levels of exercise have come under scrutiny in the popular media. Although this topic is vastly understudied, initial data suggests that athletes are far from immune to depression. In fact, empirical studies indicate that athletes are just as likely to experience depression as the general population. Prevalence of depression in athletes. Findings from studies of Wallinen, Hong, and Gross suggest that the prevalence rate of depression among college athletes ranges from as low to 15.6% to as high as 21%. On the basis of these prevalence rates, as many as 1 in 5 athletes may be depressed. Dr. Hong conducted a survey that determined depression rates and symptoms among athletes and non-athletes. When the study concluded, it showed that athletes deal with more stress than non-athletes, and they often report higher levels of alcohol use, depression symptoms, and social anxiety. Dr. Hong's study was also conducted among genders, which showed that female athletes reported the highest levels of depression. Sports injuries and depression. Injuries can often be a major cause of depression in athletes. The 3 doctors used a CSD test on injured and non-injured athletes to test this theory and found that both groups reported high levels of depression symptoms. At the end of this test, they discovered that out of those who reported their depression, 33% of athletes with an injury and 27% of non-injured athletes could be classified as depressed on the basis of the CSD results. In another study conducted by Dr. Wallinen, they used a prospective design to examine depression symptoms in athletes following injury, called the Beck Depression Inventory. The results from the study indicated that over half of the athletes, 51%, who sustained an injury during the course of the study endorsed mild to severe depression symptoms as measured by the BDI. To further test this theory that athletes are not immune to depression, they evaluated athletes with concussions and compared them to athletes with ACL tears. Athletes with concussions. There has been a recent surge of evidence suggesting that sports concussions can lead to changes in emotional state. Furthermore, there is recent evidence to suggest that sports concussions can have a long-lasting emotional impact. In a recent survey of 1,000 retired NFL players, it is found that the 9-year risk of depression diagnosis increased with the number of self-reported concussions. According to the survey, retired athletes reporting 3 or more concussions are 3 times more likely to report being diagnosed with depression when compared to athletes with no history of concussions. However, while the relationship between concussions and depression may be significant, there is also evidence to suggest that concussions may have the same effect as other injuries on mental health. Athletes with concussions versus athletes with ACL tears. To further their research, the three doctors conducted a study to examine the differences between emotional responses in the athletes who had a concussion compared to those who had an ACL injury. They found that the athletes with an ACL injury had more severe levels of depression and longer duration of depression compared to those of athletes with concussions. Wallinen, Hong, and Gross concluded that ACL injuries have a higher level of emotional disturbance compared to athletes with concussions. After this study, doctors pressed for professionals to focus equally on physical and mental health rather than only physical health. Overtraining syndrome. The doctors also studied how overtraining syndrome can affect an athlete's mental health and came to find that overtraining syndrome can threaten the overall mental and physical well-being of an athlete. OTS is characterized by psychological and physiological disturbances along with decreases in performance. There is much debate about the causes and consequences of OTS, but the research does indicate that the symptoms of major depression and OTS can appear similar. For example, burnout or overtraining syndrome is a condition where an athlete experiences fatigue and declining performance in sport despite continuing or increased training. Overtraining can result in mood changes, decreased motivation, frequent injuries, and even infections. This shows that not only are depression and overtraining syndrome very similar, it also shows that they can both take a major toll on an athlete's well-being. Career termination. Another study conducted by the doctors was to evaluate career termination because an athlete can fall into a depressive state at the end of their career. The end of an athlete's career marks a major life transition that can result in changes to an athlete's interpersonal relationships, roles, and daily routines. It is likely that several moderating and mediating variables impact the athlete's response to career termination. One particular variable that has received considerable attention is voluntary versus involuntary career termination. Voluntary career termination often leads to new career paths and opportunity paths because it is a personal decision to retire, whereas involuntary career terminations result in psychological distress because it is often because of an injury or being cut from the team. Performance and depression. From a psychological perspective, athletes may be prone to experience depression symptoms when they face declines in their athletic performance. Conceptually, poor athletic performance may result in lack of external reinforcement, behavioral deactivation, negative self-perceptions and evaluations, and the feeling of helplessness or hopelessness, which are consistent with depression symptoms. It is shown that some high-performing athletes actually may be more susceptible to depression when faced with performance outcomes that are below expectations, and sports medicine personnel need to be aware of the psychological consequences of losing or personally failing during competition. Concern with underreporting. One reason for the difference in depression rates in the study may be because athletes are underreporting depression symptoms in an attempt to portray themselves in a favorable light. In contrast to non-athletes, athletes may have some reservation when filling out a depression measure, such as coaches discovering their scores or concerns over imagined reactions to admitting being depressed. Athletes tend to portray a picture of psychological strength when assessed for depression symptoms. There appears to be a tendency to put on a considerable effort into appearing quote-unquote fine or quote-unquote okay and ready for the next competition or challenge. This is inherent to the culture of athletics, as confidence often is regarded as a necessary state of mind for competition. However, it creates significant difficulty for sports medicine professionals attempting to access an athlete's state of mind accurately. Suicide. Although it is a difficult topic to discuss, suicide has to be discussed in this project. A number of recent suicides of current or former athletes and related media attention have resulted in heightened focus and discussed on potential risk factors for suicidal behavior in athletes. Athletes, similar to the general population, in fact do contemplate and commit suicide. In a review of the medical and periodical literature, Hong found 71 cases of athletes who contemplated, attempted, or completed suicide. Of those 71 identified cases, 66 were completed suicides. The vast majority of these cases were actually male athletes, 61 cases, with an average of 22 years old for the entire sample. This is consistent with the empirical literature, which indicates that males are more likely than females to commit suicide, and that individuals between the ages of 15 and 24 years represent the group with the highest risk of committing suicide. Although suicide in athletes continues to occur, there are aspects to athletic participation that may lead to increased rates of depression and potential suicide risk. There is paucity of research identifying risk factors for suicidal behaviors in athletes and lack of information on guidelines to assess suicidal potential in athletes. Not to mention that suicide is the second leading cause of death among college students, next to accidents. In conclusion, depression does occur in athletes, and athletes are not immune to or resistant to depression just because they are in good shape. In fact, it is hypothesized that there are risk factors that are more unique to an athletic population. For example, injury, involuntary career termination, performance expectations, and possibly overtraining may increase the risk of depression compared with the general population. Clearly, depression among athletes exists. Suicide among athletes also exists, which is a tragic outcome that can be associated with depression. With this knowledge, I hope to educate athletes and others to see the signs and symptoms of depression in themselves and their teammates. I also hope to further study this topic to ensure that coaches, athletes, and parents know when it's time to take a break from athletics and take time for mental health. Thank you very much for your time. If you have any questions, feel free to email me, but most importantly, if you are concerned that you or someone you know is suffering from depression, don't stay silent. Find help through therapists, counselors, or the emergency hotlines below.